there, it's Kathy Cates and Melissa Hines from the Institute for Pelvic Health.
And you're watching Demystifying the Pelvic Floor, weekly videos providing real and simplified pelvic floor education for your real clinical situations. We've got you covered.
And today we're going to go through the extension table and how to maximize your pelvic exam and optimal positioning for your patient. So Kathy, talk to me, because at our clinic, we don't have an extension table. So I know that you do very creative things with your pelvic exams. So talk to me about the extension table.
Absolutely, Melissa. So here's an example of the extension table that we use when I worked at the federally qualified health center. So I'm guessing a lot of people use a similar one. In this picture, it has the footrests out, and I rarely ever take the footrests out because you don't have to. And let's look at all that distance that you have between the end of the table and that extension tables, the extension part. So a lot of people don't even realize that that's there. So now let's take a look. We're going to show you some different size speculums and a close-up of actually how much room you have to place the speculum, or to actually have your patient help you place the speculum. So you can see here we have the small size, and then look at all that room that you have. So much room. And then we have the medium size speculum, because I know some people would probably think, oh, well, as you use the bigger speculum, you wouldn't have enough room. You do have enough room. And then here's a large size speculum. So tons of room. And then here's the placement of one potential placement of your feet on the extension table. And here's an example of your patient guiding the speculum in, because a lot of people are now offering that, as they should. And then there's another view. And then Melissa, from a PT point of view, what do you think about if someone has super tight hip flexors or osteoarthritis in the hip or anything like that, and they wouldn't be
Yeah.
able to get themselves into that position? What do you think?
Yeah, so for a great position would be to just have your patient bring their feet just a little bit wider, like how Kathy's feet are there, and then they can knock knee and bring their knees together. And I believe Kathy would still be able to place the speculum in that way.
Totally. Yeah.
And for someone that has a lot of tightness, they're nervous, they're doing a lot of guarding, it will help kind of relax those leg muscles and and that knock knee position actually elongates the outer part of the pelvic floor, those superficial pelvic floor muscles. So it's kind of a win-win. And someone with osteoarthritis that can't really hold their legs like this, another position would be to just have them do that gentle knock knee. So
Okay.
try it out.
Yeah, try it out.
And that's a wrap. Did you like this video? If so, hit like and subscribe. Please share with your colleagues and comment below to let us know your biggest challenges with positioning your patient on the exam table.
And subscribe to our email list at instituteforpelvichealth.com to get your free guide, 4 tips for managing your challenging pelvic exam.
And when you get our free guide, you'll also get access to our weekly newsletter full of real pelvic health education, and you can use with your very next patient. And we're thrilled to announce our AANP accredited online course is now open for enrollment, and see the link to enroll below.
Our AANP accredited online course, Beyond the Kegel, is 6 modules packed with practical information that you most likely didn't get in your training. You'll get videos, templates, patient education handouts in both English and Spanish, hands-on demos, everything that you need to confidently help your patients with pelvic floor dysfunction. Sign up for Beyond the Kegel to improve patient outcomes and your provider experience.
Thanks for watching and spreading the word. Let's revolutionize pelvic health. We'll see you soon.